Hello everyone. Thank you for coming this evening to hear this presentation and see this presentation. I'm Leo Briggs. I'm Deputy Head of the DDU. Little bit about me. I've qualified as a dentist in 1989. I've worked in community. I've worked in general dental practice. I've got a master's degree in perio and I'm on the specialist list for periodontics. I started work at the DDU in 2005, initially part-time. I went full-time in 2009. I've also done some teaching down at Portsmouth University. And since 2016, I've been Deputy Head of the DDU. I've got two colleagues with me this evening as well, so they will introduce themselves. Sarah, over to you.
Hello, my name's Sarah Ide. I'm one of the dento-legal advisors. Alison and I are going to do our best to answer your queries during the webinar, and we'll pass your outstanding questions to Leo at the end.
And Alison.
Hello, I'm Alison Large. As Sarah said, please just within the questions box during the webinar while Leo gives his presentation, ask us any questions. I can see we've got lots of attendees tonight, so Sarah and I will be doing our absolute best to answer as many of your questions as we possibly can.
Thank you. So, what I'm planning to cover in the main part of the presentation are basically the main dento-legal considerations when providing care during a pandemic. And that's what the whole presentation is based on. Hopefully by the end of it, you'll understand the importance of managing the expectations of patients and appreciate the requirements for staying up to date with guidance from responsible bodies of opinion. So the first part of this is about keeping up to date. This has been one of the real difficulties with this pandemic. There has been so much information. So you're not just going to sit back and relax this evening, you're also going to be doing a bit of work and you're going to be answering some polls if you want to. It is voluntary, I need to stress that. So we're going to open this first poll now, and if you want to answer, please answer. How easy have you found it to stay up to date with the latest guidance during the pandemic? The poll is now open, so if you can start voting, that would be great, and then we can discuss the results once the poll is closed. So I'll give you a couple more seconds. The vote's still going up, so that's okay. Yeah, still right. I think I'm going to close it in a couple of seconds now. So your last couple of seconds to vote, and that's it. Let's close the poll now. That's great. So loads of you have answered, which is great, and the results are really interesting. Very few people have found it very easy to stay up to date. Most of you in the middle, which is interesting, but quite a significant number not easy at all. And that is actually not quite what I would have expected. I would have thought that more people wouldn't have found it easy to stay up to date with the guidance. The reason I say that is that we have had an enormous number of people requesting help with the guidance just because there's been so much of it. And it's been lovely to be able to assist people with that. But it's also great that the majority of people have been in the middle here. And that also shows how good we are as a profession at assimilating things quickly. I think if I'd asked this question back in April, the results would have been different, but people have now got used to having to stay up to date with things quickly, with things shifting quickly. And that is credit to us as a profession because we have adapted, we've amended very quickly, being able to cope with that level of guidance changes. So, the basics. It's essential to stay up to date because you need to do that to be able to provide safe and effective care for patients. It's also a GDC requirement to stay up to date. The GDC in Principle 7, which is maintaining, developing and working within your professional knowledge and skills, does say that you must stay up to date, and it's what patients expect. Patients expect us to keep our skills up to date and to work within current laws and regulations. We must provide good quality care which is based on current evidence and authoritative guidance. That's standard 7.1. I'm going to now talk a little bit about responsible bodies of opinion. A responsible body of opinion are the sorts of organizations that set the standards by which we are judged. They're organizations such as universities, royal colleges, the specialist societies, and the UK's departments of health. All of these are regarded as responsible bodies of opinion. And to avoid criticism, it's important that you demonstrate you followed the guidance from one of these bodies. The particular body that you're following might be in the minority. They don't all necessarily agree with each other all the time, but it's important that it comes from a responsible body of opinion. One of the things that has happened in this pandemic is that there have been lots of opinions bandied around, but they don't necessarily always come from a responsible body of opinion. And it's also important to remember that the guidance issued by a responsible body of opinion may not have much scientific evidence to back it up. We've all seen that with the issue over AGPs. That doesn't mean that you can ignore it. You still have to give it a lot of consideration. What is starting to happen and will hopefully happen more and more is that the science will be done, there will be the evidence, and then the opinions from these responsible bodies will change to reflect the findings of research, etc. But if somebody says something at the moment because this is new, because we're in a novel situation, you do have to give serious consideration to what they're saying. You need to make sure that you keep up to date with guidance issued from all authoritative sources. So keep up to date with government advice, really important. Advice from the relevant departments of health, appropriate dental organisations and specialist societies. We advise that you look at the documents which are in place on their websites. If you have printed out copies, you might find that those are now out of date because the guidance does change from time to time. So make sure that you are looking at the most up-to-date one, and the best way of doing that is using the web. And the chief dental officers, you do have to, even if you're in fully private practice, you have to know what they're saying. Their guidance is for all NHS practitioners, but you need to be aware of what they're saying and consider it if you're in private practice. It doesn't mean you have to follow it, but you need to think carefully about what's being said. And also keeping up with the best practice guidelines and standards. The sorts of organisations which are really helpful and have produced lots of guidance, organisations such as the FGDP, in Scotland, SDCEP, so the Scottish Dental Clinical Effectiveness Programme. Anyone who isn't aware of them, really good to have a look at that. They provide really helpful guidance, which is often very pragmatic and flows in a way that is easily understandable. So these are the sorts of organizations to stay up to date with. If you don't think that the guidance applies to the situation you find yourself in, that's where you use your professional judgment. No guidance is exhaustive. There will always be exceptions to the rule, but take a step back, think about the basic principles, think about the guidance, and then think, why doesn't it apply to this particular situation? And then document in your records why you are departing from that. So that's just a sensible way to proceed, is to get that documentation in the records as well. Again, because the guidance is changing so frequently, in future times, if there is a complaint or a claim, if you've noted what guidance you were referring to at the time, that could be hugely helpful in providing a response. So moving on to the next part, patient expectations. And this is the bulk of what we need to think about during the pandemic, is managing patient expectations. So the second poll now, again, it's voluntary, but it would be great if as many of you as possible can respond. So how understanding have your patients been about the changes you've had to make during the pandemic? So the poll is now open. Again, give you a few minutes to start to answer that and just see how that goes. Again, the poll's going up. That's great. Thank you for taking part in this. It's really interesting. Although I can't see you, it's good to know you're out there and voting. I think I'll close the poll now because it looks like everyone who wants to vote has voted, so that's good. And the results are that 50% of people have found their patients very understanding and 45% fairly understanding. That's great, and that is pretty much what I would have expected. Most patients do understand. They are thankful for the care that you are able to give. And again, as a profession, I think we are really good communicators, and we've been able to explain clearly to our patients what we can and can't do at the different times. About 5% have been not very understanding, and we are getting some of the complaints from those few patients who have not been very understanding. Recently, there have been a few from the patients who are refusing to wear face masks, refusing to use hand sanitizer. There's always a handful of the awkward squad out there. We have to deal with them as a profession, but it's great that the majority, or 50%, think their patients have been very understanding, so that's good news. The patient expectations, when the GDC published their new standards, they carried out patient research, and these were the results of that research. Now, the size of the circle is how important this was to the group of patients that were surveyed. And as you can see, cleanliness of workplaces, equipment, and people was the most important thing in that research, which was back in 2013. That won't have changed. People want to know that you are treating them in a clean environment. And with the pandemic, cleanliness is higher up on people's agendas. Patients are more aware of the need for cleanliness. So it is important to remember that that is really important for patients. And it's important that you communicate effectively with them. Patients expect to receive full, clear, and accurate information they can understand before, during, and after treatment, and communication they can understand. That full, clear, and accurate information before, during, and after is not any longer just about the treatment. It is also about how they are coming to the practice, how they will enter the practice, how they will leave the practice, whether toilets are open, All of those sorts of things now need to be included in that full, clear and accurate information. So again, as things evolve, as things change in your practice, make sure that you keep the information that you're giving to patients up to date. Make sure that everyone in the practice knows about changes and knows how to communicate those changes to patients. We have seen 1 or 2 complaints as well, where patients are complaining that perhaps a practice along the road is open or doing this or doing that and you can't. So a clear explanation about what you in your practice can do can be helpful. And again, make sure that you keep it up to date. As things change the information and make sure that within the whole practice, clear and consistent communication is given to all patients by all members of the practice team. It's also important not to use professional jargon and acronyms. We have been acronymed out as a profession. If you think back to this time last year, how many people would have known what an AGP was? How many people would have known what an SOP was? How many of us would have known what fallow was, what furlough was? I mean, as far as I'm concerned, fallow is something that was done to fields in medieval times. We're now talking about leaving our surgeries fallow for a period of time. All of this is jargon. And again, we've assimilated it quickly, effectively, but our patients won't know it. It's become part of our ordinary everyday language as dental professionals. But remember to translate it back into plain English for patients. That is really important thing to do. And also just make sure that patients have understood the information you're giving them. Just double check and make sure they've got enough information and enough time to ask questions and make a decision. That has been really important when the treatment choices have been limited for patients. So explanations about what's available now, what might be available if services can increase. Unfortunately, the difficult thing with that is doing the when that will happen. That's always been the unknown. When will we change into another phase of this pandemic? When can we open up more services? And I think that's been one of the most frustrating things, is not being able to give patients a clear timeline. But just make sure that you are giving them enough information that they can understand and enough time to make decisions. And of course, patients' expectations of the working environment change. The surgery from days gone by, no patient would probably be expected to be treated in an environment like that now, but it would have been perfectly appropriate back in its time. Could you imagine now having a carpet on the floor in your surgery? It's almost unimaginable. So to make sure that you are trying to manage the expectations, don't promise treatment that's not achievable. Again, significant limitations were put on us as a profession very, very swiftly. And that caused all sorts of problems with treatment plans. So make sure that you are going through things, amending those with the patient so that patients understand the changes to timetables, etc. Because again, there have been some complaints starting to drift in about, I was told this would be done in 10 months time, and some patients are forgetting that there was lockdown for a significant period of that, which mucked up the timetable. Build in more contingency plans into your timetables now. We don't know what's going to happen with the pandemic. It's looking promising that the vaccines are coming on stream, that things might start to get back to some sort of normality during next year, but it's still not fully known. So building those contingency plans so that you buy yourself a bit of breathing space, frankly, and then keep patients informed of changes, ideally in writing. That's easier said than done if the whole system shut down again, but just make sure that you do update patients, make sure you keep notes of the fact that you've updated patients, and ideally, if possible, follow it up in writing. Because I love this quote, you know, the biggest problem with communication is the illusion that it has occurred. We think that we have communicated well with patients, but one of the biggest problems is that patients don't like being patients. Not many people actually enjoy going to the dentist. It's not most people's idea of a fun day out. And so a lot of patients are just sitting there making all the right noises, making all the right head gestures, etc., but they are not actually taking on board the information because they're thinking, I want to be out of here, rather than actively listening to what you're saying. So again, just bear that in mind. Always check, has this been understood? Just a really good question to always ask yourself. Also, many patients now carry out their own research, and this can have a huge influence on their expectations. Make sure that you can do what you can to manage that. Make sure your website is up to date. There might be out-of-date information on there about how patients can make appointments, what to expect. So just make sure that you do everything you can. Unfortunately, you can't stop patients looking at all sorts of weird and wonderful things on the net, but just probe patients, ask them questions, find out what they think or what they know, what they've researched, so that you can provide them with good, accurate, correct information, because they might have been reading things out there which frankly are on the weird and wacky side of life. Also, patients might not know what to expect when they come to see you now. Make sure that you're providing clear communication about what to expect. And that includes about PPE. We have seen instances where a patient went to see one clinician who was carrying out an AGP, so was wearing the full setup. After that, they saw another clinician a few weeks later who wasn't carrying out an AGP, so wasn't wearing the same level of PPE. Sorry, using acronyms, AGPs, PPEs, but hopefully you know what I'm talking about. And the patient was really concerned because they thought that the second person was being a bit slapdash. So just some communication beforehand with patients about what to expect at each visit, including what's going to be worn by different people, because they might be expecting one thing having had an earlier appointment and get something slightly different, which could well be entirely appropriate. Just explain that to patients, reassure them. And again, we're getting used to having to wear these things and how to deal with them and what to put on, when to take it off, all those sorts of things. And we forget that it's new to patients. So always just take that step back and think, you know, is the patient happy with this? Have I explained why I'm wearing this? And just a little bit of an explanation can go a long, long way. So just remember that. Patients are always happy to be reassured, or generally happy to be reassured. And also remember about the GDC's expectations of us as a profession. Clinical is 1/4 of it. Communication is an important part, being professional, and the management and leadership. And all of those have been stressed to the max during the pandemic, especially during the early stages of it, when we were just closed down at such short notice and not really knowing what we could do to care for our patients. So that's where more management and leadership skills start to come in, and your professionalism. You need to be actively engaging those parts of your skill set if those situations happen, because it can be very, very frustrating. And don't let your frustration boil over to anger in front of patients. I'm the first one to get angry, as my colleagues will attest, but don't let patients see you getting angry with the situation you find yourself in. Some practical tips. Discuss the treatment with your patients rather than presenting treatment plans to them. Make sure that you take the time to discuss it. The more extensive the treatment plan, the more important it is to have really detailed discussions, but in language that patients can understand. Discuss the reasonable alternatives, and at the moment that might need to be tempered with, this is what I can do at the moment. I might be able to do more in the future. So that's an important thing to build into the discussions. Where appropriate, they should include the option of having no treatment at all. But obviously, if a patient's in pain, saying to them, well, I could do nothing, is unlikely to go down well. You don't have to mention all of the pros and cons of every single option for every single patient. It's what would a reasonable patient in that person's position expect. Now, some patients, the pros and cons will be more detailed than someone else, but tailor the discussions to the individual patient. Make full notes. I know that defense organizations, we always say this, we always bang on about record keeping, but it is important. Record the consent process. It's more than just a consent form. Make sure that you make some brief notes about all the discussions you have. And be careful with auto notes. Make sure that when you use them wisely. Make sure that they are appropriately edited, so that you haven't got the same wording every single time at every single appointment, because the chances are you would have discussed things slightly differently with patients at different appointments. So use them judiciously, edit them appropriately. Try and ensure that there's adequate time set aside. I know that's easier said than done, but it does take time. It does need to be a dialogue. So just try your hardest to ensure that there is that time for the discussions with patients. And as I said, focus on the individual patient. It's really important that it's not a one size fits all in your communication, that you do communicate with the individual patient. Finally, just check that patients have understood. Do whatever you can. We all have different techniques for doing that, but just try and make sure that the patient has understood. So here's our third poll question now. So I'll open up the poll now. And again, it is voluntary. How concerned are you about facing a complaint, a GDC investigation, or claim related to the coronavirus pandemic? So there are more options on this one. So I doubt we'll get a clear majority on this one. The voting's still going on. So there we go. It's going up. Yeah. Yeah, I think that's probably about it. So I'll close the poll now. There we go. And the results. 40% somewhat concerned, 20% very concerned. For those of you who are very concerned, please try not to be concerned. Complaints can happen at any time. Nobody likes to get them. But if you do get a complaint, just get in touch with us. We can assist you in getting the words right to get the complaint under control as swiftly as possible. Also, GDC investigations, please, I know that the GDC don't receive a good press. Sometimes they do things which don't help them, but they have been quite clear that they will be taking into consideration the fact that we are living through unusual times. So hopefully you won't get a complaint at the GDC. 40% of you are somewhat concerned, and then 21% in the middle. 3% of you not concerned at all, so that's great. And hopefully you've got good, happy patients that they remain that way. So moving now on to some of the common concerns that our members have told us about during this period of time. Firstly, we get a lot of questions about, am I indemnified to do a certain thing? I think some employers are asking this more and more, possibly because there are more options for indemnity. But with the DDU, we don't interfere in the decisions you make in good faith when caring for your patients. We don't have any small print. We don't have any exclusion clauses. However you interpret the guidance, we can advise and support you. Having said all of that, it's much easier for us and more comfortable for you if you have stayed up to date. And also, if you have good records, it's great, because then if we need to draft a response for you to consider sending, we can put in, and my records show I discussed this with you, which is just a little bit more comfortable than, and I recollect discussing it with you. So help us to help you by staying up to date, making sure that you are aware of the guidance and you're giving full consideration to it, and that you do keep some good records, because that will help us to help you. What will the GDC do if a patient complains? Well, they've said it expects decisions to be informed by current guidance. So that's why I've been going on so much about staying up to date with guidance from responsible bodies of opinion. But it's not going to be looking to second guess the judgments that you make. So that's what the GDC have said. So moving on now, something else which is new to the profession has been remote consultations. So again, a voluntary poll for you to take part in, which will open now. Do you think remote consultations will remain once the pandemic has ended? Yes and no. Let's see the results. They're still coming in quite thick and fast. So it's going to be interesting to see what people think on this one. Bit of speculation about the future. Right. Still a couple of votes coming in. Yeah, 75% of you have voted. That's good. That's great news. Yeah, it's still going up a little bit. Right. Seems to have steadied out. So I'll close the poll now. And the results. 55% of you think they will, 45% no. So it's pretty close. With those who think that remote consultations will be here to stay once the pandemic has ended, I suspect they will in some way, shape or form. There have been big changes with the use of digital media. I mean, this presentation, I wouldn't have dreamt that I'd be doing this a year ago, but they've become quite normal now. And I think that the remote consultations are going to form a part of the armamentarium that we have as professionals. The note of caution that I've got is that I'm slightly concerned that some patients, especially those who are nervous of going to the dentist, don't really want to go, might try and use the remote consultations for slipping through the system and just have remote consultation after remote consultation after remote consultation. And the difficulty there is that things might not get picked up that you really do need to do face-to-face. So if remote consultations do form a future part of our work, make sure again that you use them wisely, that you do keep good records, and you can just start to track those patients who you think actually, like you do with patients who've had antibiotic after antibiotic, and you get to the stage where you have to say to them, look, I can't prescribe any more. There might be situations where you say, I can't do another remote consultation. I really do need to see you. So just, again, build that into your contingency plans if they become part of our future. We have all been faced with having to learn new ways of working. It includes that remote consultation and prescribing without having carried out a full examination. The latest guidance is that we're moving back to only prescribing antibiotics when clinically appropriate to do so. So again, stay up to date with the guidance on that. And also, as I discussed earlier, you know, the carrying out treatment with sorry, I've got a bit lost here on my screens. Sorry about this. I'll just go back. You know, make sure that you do carry these things out well, and get used to the new ways of working, but make sure that you're comfortable doing them. Stick to the basic principles of good patient care. Whenever you're tackling something new, again, just think, what would I normally do? How would I normally proceed? Make sure it's safe for the patients, make sure it's safe for all staff, and make sure it's safe for you. Again, just with the PPE, make sure that you can see clearly, wearing the different things that you've got to wear. Make sure that it's safe. That's the basic principle to stick to. Again, make sure that you maintain confidentiality with remote consultations. It can be easy when you're doing them from somewhere not in work to perhaps end up breaching confidentiality inadvertently. So make sure that you're doing it in a confidential place. Make sure that you have patient's consent and keep good records. That's the end of the main presentation. Just a little bit about the DDU. As you probably know, we're the specialist division of the MDU. We are a not-for-profit organisation, so we are here, we are run by our members, for our members. And I think we get really good results for our members. As you can see across the bottom, we get good results. We're happy to publish those results. So that shows you that we think they're good. And advice is just a phone call away. We are going to open up the questions now, but any of you who are members, if we aren't able to answer your question, we're going to put up as much information as we can on our website. But if in doubt, just give us a call. Although we are open 24 hours a day, it's ideal to call between 8 and 6 because that's the time that the lines are mainly open. Out of hours, you can always get through to an advisor, but it can take longer. And we are open 365 days a year. Ideally call between Monday to Friday because that's when most people are on duty. And in fact, this year we're around 366 days a year. So on that, I will now bring back my colleagues, Sarah and Alison, and we'll move into the question and answer phase of this. So, Alison, have you got a question?
Absolutely. We've had quite a lot of very interesting and varied questions come through. One question that has come up, and I just find it, is about whether dentists will be asked to administer the new COVID vaccine.
Oh, right. Yeah, no, that's an interesting question. I think it's going to depend which country in the UK you are in. Obviously, each country is doing things slightly differently. There was some guidance from Scotland today, which is again asking for expressions of interest in doing this. In Scotland, it's going to be up to the local health board whether they involve dentists and the dental team. So each area in Scotland will possibly do things slightly differently. In England and Wales, in England and Northern Ireland, they've asked for expressions of interest, and that is, and the same in Scotland. They don't want to take dentists out of frontline dentistry. What they want is expressions of interest from people who could do this in addition to their normal clinical work. If you are going to take part in it, you have to make sure that you're fully trained to do it, you're competent to do it, and the guidance from England has set out how that will be provided. They have got a training document out there, what's expected of you, including having done basic life support training as part of it. How to get consent will be part of the training that you get. And it looks like it will be carried out in specific centres, so not in general dental practices. And all the indications are from the different countries that people doing this will have NHS indemnity for doing it. But it certainly looks like the departments of health want to utilise us as healthcare professionals if we've got the capacity to do it, but they don't want to take us away from frontline dentistry. Yeah.
I was just going to say, following on from that, we've got a little bit of a LinkedIn question to that, is about are dentists likely to be considered frontline workers? And I believe they have confirmed that, but also whether there's a possibility that dentists will therefore have access to the COVID vaccination.
Well, yeah, I mean, we have been confirmed, the dental team have been confirmed as key workers. So hopefully we will be treated as all other healthcare professionals and all have access to the vaccine at the same times that other healthcare workers do. I haven't seen anything yet which actually specifies any timetables. I suspect they've got to wait before they can actually launch the different vaccines and decide who's going to be the #1 priority, who's going to be the #2 priority, etc. But hopefully we'll be up there. Fingers crossed. Yeah. Sarah, any other questions?
Yes, we've got a question about Botox and fillers, Leo. People are wondering, can they be carrying out this form of treatment at the moment?
I think a lot depends on where you are. We're in England, we're coming out of lockdown, we're going into our tiers. Scotland are in their different tiers, which I know are different to the English ones, and there's been guidance issued about being in tier 4 in Scotland, which makes it quite clear that doing something which is not essential for healthcare could be problematic. Wherever you are, I think you've got to think about the wider guidance that's out there. It's not just whether you can do things safely in your surgery, whether you've got capacity to do it in your surgery, whether you've been able to treat all your urgent patients and any backlogs. All of those need to be taken into consideration before deciding if you are going to move into non-urgent and move into aesthetic and cosmetic care. But you also need to think about the wider guidance out there about patients traveling, etc. So where does your patient pool come from? How are they going to get to your surgery? Is it safe for them to do so? Is it appropriate to ask them to come to the surgery for something that's not essential? Is it appropriate for them to have something done which is purely cosmetic at this time? And also, I've forgotten the name of the organization, but there is an organization that would be regarded as a responsible body of opinion that provide guidance on Botox and dermal fillers for healthcare professionals. And as they've made it clear, there should be a medical reason for doing this. So if there is no medical reason and it is purely cosmetic only, I think that questions might be asked of you which might be difficult to answer.
Thanks.
Alison, any other questions?
I was just going to say that the guidance you were looking for, I think it was the JCCP
Yep.
that gives the guidance on cosmetic treatments. I mean, really just following on from that, we've had quite a lot of questions about people being within their practices at different stages of providing either emergency treatment or urgent treatment, and at what stage they look to be providing something that's considered more routine. And I think this variation in the questions we're getting reflects what we're seeing across the country, and how different regions are affected, in addition to where individual practices are on them returning to some sort of normal practice. So lots of questions just on that theme, Leo.
Yeah. I mean, there isn't an easy or a simple answer to that. It has to be bespoke. Each practice needs to do its own risk assessment. So much depends on the facilities in your practice. Do you have windows? Do you have ventilation? Do patients have to go up and down stairs? If they do, how are you cleaning things like handrails in between patient visits? So each practice will have different circumstances. They'll have different facilities, so they will have they'll be at different places as to the care that they can provide. So it is not, there's not going to be one uniform answer. And then you've got to lay on top of that what's happening in your region. What's the local outlook? Are you in a higher tier than the region next door? Does that make a difference to what you can offer? So that's where you have to be able to interpret the guidance, and you have to move back to that basic of, is it safe to do this? Is it safe to move on to another stage? Is it safe for me to do AGPs? All of those things. And each practice is going to come up with different answers. What I would advise is that you keep documentation of your decision making that was done at the time you make your decision. so that if you are ever asked questions, you've got that to fall back on to say, I did it at this time for these reasons. And that could be hugely helpful. And then if things change, so if the restrictions in your area change, if the guidance from your chief dental officer changes, if the guidance from your local area changes, you reflect that in your risk assessment. I know it's onerous, I know it's a lot of work, but it is time well spent so that you've got that done. You've gone through it logically, methodically, and you've got it documented. I hope that answers a lot of people's questions, which I know will be really quite bespoke. But and again, we do get asked quite a lot from people, can I do things like airflow? Can the hygienist treat patients? All of those things. If you're providing the treatment in good faith, you are indemnified if you are a DDU member. But just what we would always advise is that at your practice, you do that risk assessment. Make sure it is safe for patients, for staff, for you, and have that documented. And then you can decide whether it is appropriate for you to do that task, treat that patient, treat those groups of patients or not. And that's, I think, the way to approach it methodically. Yeah. So I think, Sarah, any other questions?
Yes, we've got a question about indemnity for carrying out COVID testing or antibody testing at the practice in general terms, really.
Right, yeah. If it is for dental care for your patients, you would be indemnified to do it. Firstly, I'll take a step back. Unfortunately, there are a number of people out there who are trying to make money out of the pandemic. And there are a number of tests that are being sold which might not be as legitimate as the salespeople make them out to be. The same has happened with equipment. We've been aware of a few members who've been hoodwinked, quite frankly, into buying equipment that says it can do this to the air, it can do that to the bugs, and actually it doesn't stack up. So the first thing is, make sure that if you are going to do anything like this, buy anything like this, it is the real deal and it can do what it says. Remember, if you offer that test to someone, you are responsible for it. So you will have to explain why you thought it was appropriate for you to do it. As far as your indemnity with us is concerned, if it is for patient care, we provide indemnity for the practice of dentistry. So if it is for patient care, then it could be carried out. If you're doing it for other reasons, we wouldn't indemnify it. So for example, if you want to test staff, fully understand why you might want to do that, but that's actually an occupational health reason. You're not doing it because you're doing dentistry on those staff. So we wouldn't indemnify that. If you are doing it so that patients can travel or things like that, again, that's medicine, not dentistry. So we wouldn't indemnify that. But I think the important thing is don't rush out and buy these things. Think carefully, why am I doing this? Is it appropriate for me to do it? Do I know that this is safe, and am I doing it for dental reasons? So I hope that's answered that question. Alison, I think we've got time for maybe one or two more questions. So Alison, any more themes that have emerged?
One theme that's definitely coming up, and we've got a number of questions surrounding it, relate to remote consultations. It seems like some people were asking questions because they're having difficulty obtaining a medical history from a patient over a telephone, and related to that, patients being very difficult and unpleasant over the telephone. and also some questions about whether it's acceptable to make notes, for example, on their own laptop because they're working at home. So really sort of three strands to that: those difficult patients, the medical histories, and also the recording of records somewhere other than the actual computer system in the practice.
Right, medical histories, first of all, absolutely fine to get a verbal medical history from a patient. I think the difficulty with remote consultations is because it's new to us, it's that gauging, am I getting accurate information from a patient? It's much easier to pick up on the non-verbal cues from patient when they're sat down in your chair and you're asking them questions and you start thinking, oh, not sure that I'm getting the full picture here. And that's more difficult with some of the remote consultations, but it's absolutely fine to get that information remotely. You don't have to have it signed. Make sure that you ask the questions, all the questions, and that you record all the answers that are given to you. And if you think that the information might not be complete, might not be fully accurate, probe the patient, ask some additional questions, ask around the subject, as you would with any patient who's sat in your chair and you're talking to them face to face, to try and gauge how accurate the information is. So that's the medical histories. The second thing about writing notes on your own laptop, that moves into all of the data protection laws. If you are doing that, then you would have to be a data controller. So it would be better if the information is recorded on a practice machine or is transferred to a practice machine rather than you storing it on your own machine. And then also you have to think about what would happen if something happened to your machine, if it was stolen. Do you have the adequate safeguards built into it to protect that confidential information? The other thing is you've then got to get it transferred into the practice system. And again, different practices will have different ways of doing this, but get it transferred safely and quickly, because it might be a situation where you telephone triage a patient, they phone up and speak to someone else. They need access to that information that you have taken from them. So try and get the system integrated so that it can provide good care for patients, as would happen in the surgery. When you're in a surgery, what reception writes, you've then got easy access to straight away. Try and make sure that however you do remote consultations, that you can make sure that everyone has access to the information quickly and that it is accurate. If information is being transferred, say from a laptop to a work computer, will there be any issues with it? Will the words get jumbled up somehow or anything like that? So you just have to think, is this accurate? How well is it being presented? So I think the ideal is that if you are doing it remotely from the practice, remember you can do remote consultations in the practice so that you're there with the computer, the patient is remote. But if you are also remote, then you have to think carefully about how you're going to store the information, how you're going to get it to the practice, and then make sure that when it is at the practice, it's being transferred to the system effectively so that it doesn't get corrupted in some way, because I'm the last one to be able to advise on IT, but I'm the first one to make things go gobbledygook by pressing the wrong buttons. So yeah.
So Lee, I was just going to, sorry to stop you, I was going to say we've got lots of questions about remote working, and just to say that we've got information on our website about that. So hopefully a lot of those questions that are asked are there. And I think the other one was about difficult patients, and I'm just aware that we've got limited time, but I don't know whether you can just give a few words on that point.
Yeah, I mean, difficult patients, it's as they are if they're in the surgery. You know, you treat a difficult patient as you would normally. Treat them carefully, try and stay calm, stay cool, calm, collected, always act professionally. But you know, you can be firm in your views. Sorry, I can't do that. You know, we might, you know, I might not be able to do that for you. Don't be bullied by a difficult patient. And I think that's time now. So thank you very much for joining. Sorry about the glitch with the IT. If any of you could hear dogs barking in the background, I apologize for that as well. Hopefully you couldn't. And I hope that you found this interesting and enjoyable. Thank you.